Speaking on the observance of World AIDS Day 2020, Minister of Health Dr. Frank Anthony reflected on the numerous interventions that were made over the past year to reduce the risk of persons acquiring or transmitting the human immunodeficiency virus HIV. Pointing to the dissemination of PrEP, pre-exposure prophylaxis, which started in 2019, Dr. Anthony highlighted that the drug has been an effective HIV prevention method in which people who do not have HIV take HIV medicine daily to reduce their risk of getting HIV if they are exposed to the virus.
We believe that this is a very effective way of preventing HIV because, if somebody is HIV positive, then they'll have to be on lifelong treatment. If you can prevent the infection from happening, then it saves in so many ways, not just money, but it prevents that person from getting sick and having to use medication for the rest of their life.
PrEP was introduced to Guyana as part of a public-private partnership arrangement where private physicians across the country supply the drugs to persons who meet the criteria. PrEP is currently being offered to serodiscordant couples where one partner is living with the virus and the other is not. Program Manager of the National AIDS Program Secretariat, Dr. Rhonda Moore, informed that there are two types of PrEP available in Ghana at the moment.
Daily oral PrEP, so this is taking one of the PrEP pills daily, and you can take it for a prolonged period, and stopping this pill will depend on a discussion with your physician and actions that you would have taken to reduce your risk of contracting HIV. The other form of PrEP that we have is what you call PrEP on demand or event-driven PrEP.
Dr. Moore emphasized that while PrEP significantly reduces the chance of an uninfected person contracting the virus from an HIV-positive person during intercourse, it should be used in collaboration with other preventative measures.
PrEP, it is not a magic bullet or pill, so you must also encourage condom use for our key population, the use of lubricant, and also we must do assessment for other sexually transmitted infections, as well as encourage those persons to reduce their risk by reducing the number of partners or sexual partners that they interact with.
She noted that the next step will be to target persons from the LGBTQ+ community.
Move beyond looking at serodiscordant couples and look at our key populations, especially our transgender women and men who have sex with men. As when you look at the HIV prevalence across the Caribbean region, you will realize that these two subpopulations are disproportionately affected.
World AIDS Day, observed annually on December 1st, this year is being observed under the theme Global Solidarity, Shared Responsibility. Dr. Anthony said Guyana remains committed to ending the AIDS epidemic by 2030, which would require an unceasing effort and shared responsibility not just from the country's international and local partners, but also persons living with HIV and AIDS. As of September 2019, there were 8,200 persons living with HIV and AIDS in Guyana. Temika Rodney reporting for the HGP Nightly News.